Hey everyone, welcome to the Lab Entrepreneur. I'm Elias Farah, CEO and co-founder of Medfar, and this is the podcast where we chat with amazing people transforming the healthcare and the lab industries. Today, I'm excited to introduce Alex Alvarez, the CEO and founder of Helix Diagnostix. Alex started in the clinical lab space in 2012 and quickly dove into mastering revenue cycle management and every aspect of the lab operations. Over the years, he's worn just about every hat in diagnostic testing, and his proudest moment, launching Helix Diagnostix, where he's now leading an incredible team he considers family. Together, they're all about helping provider deliver fast, safe, and accurate patient care with cutting-edge tools. Beyond his professional role, Alex spent time with his family and give back to his Miami-Dade community by mentoring future leaders. His story is inspiring, and I can't wait for you to hear it. So let's jump in. Alex, welcome to the Lab Entrepreneur. It's great to have you on our podcast.
Thank you for having me, Elias.
How are you doing?
I'm very well. How are you today?
Very good, very good. Perfect. So let's start from the beginning, Alex. If you can just share with us how it all started and what inspired you to start your own lab.
Yeah, it's a long, winding story, like many of our stories are, right? I started my career, like you mentioned, some 13 years ago in revenue cycle management, working for a billing company. I worked my way, many folks, they find themselves working in laboratory first and then learning billing processes. For me, it was peculiar, if you will, because it was kind of reverse engineered. I started working in billing and then worked my way into operations. So I had around 2015, when I started working in my first laboratory company as a director of operations, I had a pretty good foundation and understanding of how the billing process works, right? So the business aspect of providing the service from a laboratory standpoint. So I was able to kind of connect the two as far as a holistic view, right? What goes all the way from a sample coming in through the door all the way to claim adjudication, what the complete process looks like. So being able to paint that whole picture, I would like to say equipped me with some unique tools to be able to drive some very key important factors all the way from a business standpoint and then patient care. When you marry those two together, we can definitely create a very unique product, which is what we have today at Helix Diagnostix.
And you just decided to jump in.
Well, I worked in a clinical lab space as a director of operations from 2015 to 2020. In 2020, after about 5 years, I'm a person that I'd like to have a continuous process of growth, ambitious, if you will. So I'm always trying to push the boundaries, create new challenging things. So in 2020, one of my best friends, business partner, and I, we decided, hey, let's go ahead and let's start our own laboratory. And that, like you mentioned, was definitely a jumping in, a big leap of faith, as starting a new business venture is a risky undertaking, as many other entrepreneurs know.
And did you took any outside investment, or you started with your own from zero with your own money?
Just us two. So we started with our lunch pails, our know-how, and our own in-house funding.
And what looked like the early days? How it felt in the beginning? How fun it was? How hard it was? Tell me more about the early days.
One of the very, very early days. This is our 5th year in business. Time flies, right? Here at Helix. So the very early days, we started with just 3 laboratory instruments, doing, if I recall, I want to say somewhere between 40 to 50 patient samples a day. Fast forward 5 years later, we have over 11 instruments in-house, medium to high complexity laboratory doing well over 250 samples a day. We boast a staff of roughly 20 employees.
Nice.
When we first started, we had about 4. So we are now nationwide in reach. We're licensed in California, Indiana, Pennsylvania, New Jersey, Maryland. We have clients all over, Kansas City as well. So we are able to extend our services to not just patients in our backyard here in Florida, but to patients and providers nationwide, coast to coast.
Yeah. Can you talk to us about a pivotal moment that shaped your vision for Helix?
Absolutely. So In my experience, our industry faces a lot of challenges. Some of these challenges definitely being network status and being able to join some payer networks as an in-network provider.
Yeah.
So noticing that certain larger conglomerate corporate laboratories, not to name any, have somewhat of a stranglehold on the industry. So the end result of that has been extremely lacking customer service for providers. Whether they want to pick up the phone and speak to an experienced laboratorian about a result, or a turnaround time, which is critical for driving patient diagnosis, right, and for better patient outcomes. So some of these larger laboratories, just because of their sheer volume and size, what a test for us takes 24 hours to provide a result, which could be life-saving. For some of these laboratories, the larger ones that I'm referencing, could take anywhere from 3 to 4 times as long to be provided to the provider.
Perfect. And how did you overcome the first hurdles of staffing? You started new, you didn't have a lot of cash, you need to hire, but you need to hire cheap, but you need to hire great people to make the difference. How you overcome staffing, where you find your people, how you hire?
Well, especially over the last 4 or 5 years, we've had some significant staffing challenges, right? Due to COVID especially in our healthcare and laboratory field where, this arena was at the helm of testing nationwide for the COVID-19 pandemic. So what we ended up seeing was a lot of shortage, a lot of laboratory professionals, they retired or they started working in large, big hospital settings with contractual obligations. So what that meant for the independent laboratory, such as ourselves, was that the pool of candidates and talent was very shallow. So, we've definitely been blessed, myself and our management team. We've found some very, very good employees. And how we've gone about it is very straightforward. We've posted publications on companies like Indeed, ZipRecruiter. We receive, potential candidates that apply directly through those links. We set up interviews and we're able to, thankfully find some very, very good people. And that's just a good judgment of character during the interview process. Being able to, identify and say, hey, this person is going to be a good fit for our team. And thankfully it's panned out.
And how you're approaching finding new customers and winning clients back in the days, and is it different today?
It's different and it's complex, right? Complex in the sense that you have so many different providers that need laboratory services. However, I'll give you an example. A primary care physician is going to find himself in an in-network status with the majority of commercial payers, Medicare, Medicaid. So, for example, we are an out-of-network provider momentarily with a lot of the large insurance companies. That is not by choice. Okay, we have made very strong efforts and pushes as far as working with attorneys, working with consultants to try to achieve a network status. One of the big issues that the industry faces is that these large insurance companies have closed their networks for north of the past 10 years. They do not allow independent laboratories to join and participate in their network, which, it's something that needs to be looked at a little bit more closely. There's a lot of lack of oversight as far as how unilateral they are in making these, policies as they go. Part of the issue becomes that if we're able to achieve this in-network status, we're cutting patient costs, whether that's out of pocket, patient responsibility, deductible, whatever the case may be. Because when you're in-network, claims process a little bit differently. There's an agreed upon rate. There's no surprise out-of-pocket expenses. So one would think logically that it's in the insurance company's best interest and in the provider's best interest to be able to have as many participating providers in their network as possible. But there's, of course, other invisible factors that, we can only, imagine what's going on behind the scenes.
So I understand the first step for you is to find ways to get into this network of this insurance company. And after you start prospecting, finding physicians that would send.
Right. And, the second part of my answer to your question is, so now we need to find clients that are synergetic with our network status, right? So we do have a large, diverse client population where they are out of network, just like we are. And they find many providers find themselves in an out of network status by choice, simply being because they provide a specialty service or a service that stands apart from one of these big, large generic providers where there's really no difference to and from. What I'm driving at, for example, our success here is purely predicated on two very important things: excellent customer service and very fast results. So customer service is really the driving force behind what we do here. Providing a client with that, first-class white glove service, we like to call it, where they walk away from an experience working with us and they say, wow, we live in a day and age where unfortunately customer service feels like it's a dying art. And, we need to hold that banner because that's really, as nominal as it may sound, it really sets you apart when you're able to answer that email quickly, or you're able to get back to a customer or answer the phone. Something so simple nowadays, which used to be commonplace in the past, is not so much anymore.
Perfect. So it's true to say that your secret sauce is a combination of very white glove, close customer success, customer service with a fast and speed results.
Absolutely. So, just to add a little bit more color to that, we have some clients that are in inpatient levels of care. These are clients where something and I'll just use some generic terms, a blood chemistry like a potassium, something that, general terms we can understand. If you have laboratory A that's providing this result within, let's say, same day service, 8 hours of a turnaround time, and you have another laboratory B that's providing this result in 48 hours, but this patient had a critical value that could be life-threatening, you potentially just saved this patient's life by administering the proper care based on that diagnostic result. So we're dealing here. These patient samples are an extension of the patient. So that's something that we really like to make a point of emphasis as well.
And now with the AI coming into the industry, and I see a lot of companies leveraging AI and AI bots to service and support their customers. Are you a believer in this? Do you see AI to help customer service part of the strategy, or you still feel that you're going to rely more on the human factor and the more proximity with the customer delivers this excellent customer service?
I'll tell you what, Elias, I think that there has to be a balance and a combination of both. So I'm a big believer in using the tools at hand, especially technology, to be able to, provide the best product, right? Whether those tools could be analytical software, Microsoft Excel, to be able to provide you with, metrics that you need to be able to determine, hey, this test has more utility than, this other one, for example. Our energy and our focus is better invested in this area of testing, to give you an example. But the reason why I say it needs to be a balance is because I fear that some companies are going to go ahead and default, and just for cost-cutting purposes are going to eliminate that human element and just divert everything to AI, whether that be for customer service solutions, such as taking a phone call. I think that there are ways that it can be implemented that's going to accelerate and cut waste. But however, when you have human beings involved, which ultimately you will have to, you still have that personal touch, that element that the client feels, hey, I have a point of contact. It's not a chatbot. This is somebody that is going to provide me with the service that I need to be able to provide the best service possible.
Yeah. And if you had to bet on AI in a specific in the lab industry, which area you think AI will transform the most and will really disrupt and bring value to you and your customers?
So I see right now there's some development going on with robotics, right, in the laboratory space. So in a laboratory setting, for example, when samples arrive, they are processed into a computer system. This is a manual process with human manipulation, where humans accept, they touch the samples, they handle them, they process them, they label them. There are robotic instruments coming out now with AI interfaced, where, for example, blood tubes go onto a rack, they're scanned by a computer, they're labeled by a robotic arm. So for a mass production or large throughput of samples, this is type of automation that's welcome and can definitely help streamline the ultimate result, which is that patient report, right? Those values that are so critical to get to the provider as soon as possible. So those are certain areas that are definitely exciting to see how they're being pioneered at the moment.
Awesome. Let me shift gear to more operational questions. What are the top KPIs that you follow? And like top 3 KPIs that you follow, and how often you look at them? You look at them daily, weekly, or monthly?
We definitely look at these almost daily. One of our KPIs that we like to do, we run a report here in-house called the turnaround time report. So we look at a couple of key columns when we're looking at this report, from receive date to reported date. The computer, our software gives us an average turnaround time, okay, per sample volume. So we know down to a test what our average turnaround time is for that specific test, whether that's a hepatitis test or a complete blood count. We know exactly where we stand, and that also gives us the opportunity for coaching moments, right? How can we make our process better? Here at Helix, it's a constant, never-ending process improvement. That's what we strive to. Because if you're not looking at these informatics, you're kind of steering your ship blindly.
Awesome. And so, how many people you are today? If you don't mind making a repeat, like you mentioned,
we have just over 20 employees, and we started in 2020 we had about 4 when we first opened our doors.
Perfect.
So we've grown. We've definitely grown. It's been exciting.
And do you have a cadence of meeting with your team? Do you meet with them every day or every week, or do you have town halls with them?
So we have constant communication. I mean, my door is always open. We have manager level employees as well that meet with their teams on a daily basis. We try to do weekly meetings where I'm involved as well with our team. And what we like to do is provide a forum where our team is able to speak freely. Hey, these are things that we see that we recommend and suggest. This is an extremely positive work environment that we fostered here, where it's very family oriented. We're team driven. So this isn't a one-way street. It's definitely two-way. Our employee input is critical. At the end of the day, you're only as good as your people.
Perfect. And what qualities do you look when hiring people and building teams?
Work ethic. It's definitely a big one. You can't coach it. Some folks are driven. Some folks want to work. Some folks want to invest in your company, and there's a mutual understanding that investment is reciprocated. So I feel that we can see that early on in the interview phase. We see how folks present themselves, whether they're on time, and how prepared they are. Some folks will go as far as going on your website, reading about your company. Some folks don't remember what position they applied for. So these are just some small things that you can pick up. And again, in a very challenging day and age of staffing for laboratories. So these are very key, important things that, as lab managers, operators, owners, we need to keep a keen eye for.
Yeah. First question for you, Alex, how you develop yourself, how you keep yourself updated in leadership, in management, and in the lab industry?
A lot of reading, a lot of networking. So, I read a lot of The Lab Manager. That's just one of the magazines that I subscribe to. Multiple different forums. The Dark Report is another great resource. Networking with other laboratory providers. Also, one of our companies that we work with, one of our vendors, big laboratory community as far as groups, different associations that we are a part of, user conferences, to name one, G2 Intelligence, which is fantastic. Those user groups provide a great forum for networking. And, it's, as an independent laboratory industry, we really rely on each other to be able to communicate and say, hey, these are the things that we're seeing. What's new in testing? What's new technology? What new tests are coming available? CMS is another great resource via cms.gov's website, where publications are made, to even touching on coverage determinations. These are all critical things, even from a compliance standpoint, that we all need to stay well versed in.
Correct. You mentioned independent labs a couple of times, and here I'm going to go and ask a couple of tough questions around the current landscape and the market dynamic in the lab industry. We see a lot of consolidation, those independent labs being acquired by the big corp like LabCorp and Quest. What's your take on this trend?
Well, I think it's about cornering the market, right? One of the big issues that we see here is this constant, it's runaway rampant growth, which for them it's a great thing, right? But as you continue, one of the things about COVID-19, which there weren't many silver linings at all, but one of them for the independent lab industry was that it proved to the United States, to America, that hey, independent labs are the backbone of diagnostic testing in this country. Companies that you mentioned, like LabCorp and Quest, they found themselves absolutely inundated. They did not know how to react to the pandemic because they simply didn't have the resources as large as they are. So the brunt of that testing fell to independent labs. Okay, going back to what you were saying, why are they acquiring all these labs? It's really just a matter of cornering the market. It's a monopolization by two large entities. And we're over here fighting the good fight.
And how I'm curious to know how you're fighting back, how you're competing and still thriving against those large players.
Elias, I've had clients as recent as last year that they've contacted us and they've said, hey, we're interested in using your lab for services. I always have my discovery questions that I ask and our sales team, and I want to know what are some of the current deficiencies that you have with your current laboratory provider. And it's funny because it's always, not always, but most of the time, it's two very important things, which are the two important things that I mentioned that are really a driving force for our success. They have no customer service that they receive. There's no point of contact. When they pick up the phone and they dial, it's a 1-800 number where they get some offshore rep that is not in the laboratory and has really no means of helping them with whatever question it is that they have, which are always going to be boiled down to that patient sample and a result. Okay, so that, and then the turnaround times. I mean, it's critical. Again, we're dealing with patient lives. So we really make it a point. These are the two things that if we excel at, we're going to stand apart.
That's very inspiring, really inspiring. And another market dynamic that I think it's threatening to build the labs, the medical labs in particular, is that the new FDA regulation about the LDTs. Are you concerned about those new regulation and how might they impact your lab?
Elias, I'll tell you what, we have some good understanding, but limited information because there's limited information out there. Okay. From what we know, this is, if you're a laboratory that is, if you will, grandfathered in, okay, you have existing LDTs, you won't necessarily be impacted, right? But if you're a laboratory that's up and coming, you're new, and this has already passed, there will be no LDTs for you. Okay, so what that means from a laboratory testing standpoint, this is a huge deal, and here's why. There are a large number of available in vitro tests for patients where these are not, a la carte, out of the box, FDA approved tests. I'll give you an example. A test that would be something like a hemoglobin A1C, where it comes with a product insert, out of the box, FDA approved. These are the defined parameters of this test. Some tests have more of an analytical element to it, which is where your inspecting or accrediting body is critical because they review the efficacy of these tests to ensure that they're not just safe, but compliant and accurate to be able to provide for patients. So there's a huge patient population in the U.S. that relies on these LDTs. And there's just going to be a massive limit, if this does proceed, to the accessibility to those LDTs.
Correct. And other than the market consolidation or the FDA new regulation, what are the biggest challenge that keeps you awake at night?
We're living through times where there's, such craziness happening every time you turn on the TV, right? Whether it be related to health insurance executives or, cuts to reimbursements for providers, where there's a negative relationship, right? Because there's increases for consumables every year, but yet reimbursements want to be cut. So at a certain point, these are things that you have to think about. We're here for the right reasons. We're here to provide great service and, improve patient outcomes. But, there's these continued forces that are working behind the scenes, whether, like you mentioned, with consolidation or some of the things that I'm talking about, even as something as simple as opening up network participation to some independent labs, could really save a huge industry in this country. And I would say the other thing that really, is somewhat worrisome that I think about is staffing, right? So we don't see in universities or colleges young folks lining up to graduate and be laboratory professionals. It's just not happening. So you see more and more of them they've retired, or there's fatigue also in the industry. So I think right now there's a pretty eye-popping statistic out there that for every 30-some laboratory licensed openings, there's about one applicant, which is pretty wild to consider.
And how are you compensating? Are you shifting more dedication on your side and hiring from outside the industry and training those people?
We've been lucky in the sense, Elias, that since we're located in South Florida, this is a big metro area that over the last 5 years has had an increase of people and folks migrating here, probably for the weather. But our talent pool here, because of that, has been a little bit more manageable. But I sincerely worry about, let's say, laboratories or even, individual providers where they work in rural portions of the country, areas that are not very populated and that have even seen people migrate out over the last few years. Where are these folks finding the licensed personnel to be able to run and operate? And if they're not, I fear that some have already and some will close their doors. So a suffering industry, that situation just continues to perpetually get worse.
Talking about challenges, every business has its own setbacks. Can you talk about a particular tough challenge that Helix has faced and how you overcame it?
Okay, let's see here. Challenge that we've recently overcome. I'm trying to think, and I got to tell you, I'm having a hard time recollecting because we're pretty good at what we do. But definitely one of I'll tell you what, and this is, again, I hate to continue to harp, but it's about staffing. So around the year 2022, we noticed that we were having a little bit more turnover with licensed personnel than we regularly would. In that sense, we found ourselves, we run an operation that's Monday to Friday from 9 to 6 p.m., right? And we operate on Saturdays with about 5 hours on Saturdays, okay? Because of that turnover with licensed staff, we found ourselves in a position where you have to adapt to survive. You have to continue to evolve with the times. So what we did was we created a combination where we started staffing full-time employees on staggered shifts, and then we started bringing in part-time employees, licensed personnel as well. So we expanded our hours to work from 9 a.m., 6 p.m., from 9 a.m. to 9 p.m., Monday to Friday. So it's one of those things where at the time what seemed like a big challenge ended up being a big blessing, because we ultimately were able to expand our hours, expand the amount of throughput of tests that we're providing, and additionally, what does that result in? Faster results. Because a machine that would usually be put to sleep or would stop being run at 6 p.m. is now running to 9 p.m. And this was purely due to saying, hey, I can't staff an employee now that's full-time, working 40 hours a week, Monday to Friday, but now I can get that position and I can staff 2 or 3 part-time employees across staggered shifts. So around that time in 2022, we did see a big evolution as far as our staff structure. And we also did start to see some growth as far as, the manpower that we were able to handle. So what was a curse somewhat turned into a blessing.
Awesome, man. It's crazy how great entrepreneurs are able to convert a threat into an opportunity. And what would you say to a lab owner who is struggling to grow, is facing financial or operational challenges today?
Ask for help. There's no shame, and I've needed help in the past. Rely on others. There's always the beauty of an attitude of gratitude and maintaining humility is that there's always infinite resources. Sometimes we feel that, our ego gets the best of us. We don't need any help. We can figure it out. There's nothing wrong with figuring it out, but there's always somebody who knows more. And you can always learn somebody from someone else, myself included. I learn something from my employees every day, and vice versa. So again, the process of never-ending improvement. How can we be better? So my advice is that use the tools out there, whether it's a user group or a conference, network, ask folks for help. There's consultants out there. And consultants, you have to be careful how to decipher who knows what they're talking about and who doesn't. Because, we can run into that. And I'm looking for consultants. But, back to the point, there's tools out there. So just ask for help and know exactly what the area of deficiency is where you need that help, and focus on one at a time.
And I can see how this is connected to your community work that you're doing at Miami, helping entrepreneurs there. Can you share a leadership lesson that has particularly valuable to you and you think is going to help every other entrepreneur?
Absolutely. So, a leadership lesson that I learned very early on in my career, and I teach this to some of the younger folks that are up and coming. Presentation is not to be undervalued or understated, right? So, where I see younger folks, this younger generation, where there seems to be a very laid back approach to how we present ourselves, how we respond to an email, how we answer a phone call. First impressions are everlasting. That's an adage as old as time, but it's something that I continue to pass on because it's so important. When the way somebody presents themselves comes across on that email, comes across on that phone call, okay? And you don't have to be. There's a big difference between education and intelligence, right? Okay. There's a way where we can project ourselves and come across where, hey, not only am I invested in my time with you or what I'm presenting to you, but I care. And again, we're living in times now where something like that in the past, which was so nominal, nowadays is setting many people apart. So that's something I continue to push through and pass on to the younger generation of leaders. Just care. Dress, be presentable. Bring your resume with you to the interview. A lot of folks don't do that anymore. Very simple things. Okay. Be a professional.
Awesome, man. Really, really impressive. Where do you see Helix Laboratory in the next 5 to 10 years?
Right now, I don't want to divulge any secrets. We're working on some very, very exciting products, which are going to be direct to consumer in states that legally allow direct access testing. Okay. So we're going to be able to bring to market certain tests where a patient will be able to have these directly in their home. So that's something that we plan on launching later on this year. Okay. So we plan on really becoming a household name, a household brand where, the clients that currently work with us, those of referring providers, where they know, hey, we were with these guys from the beginning. We know what they're about. And I'm excited to see 5 years down the road how, we can exponentially increase our reach, to dozens of other referring providers and directly to patients across the United States. And hopefully we're a household name in the laboratory space.
And how do you think the lab industry will evolve in the coming years? And what should smaller labs do to prepare for these changes?
I think that we're going to reach a nexus point here over the next couple of years where there's going to have to be some sort of regulatory intervention, whether that be from Congress on a political level, where laboratories are going to have to, make legislative pushes for some sort of equality with some of these larger conglomerate labs, some sort of consistency with payer policies for large commercial payers, where it's been peaks and valleys as far as the consistency, right? It's up and down. Things change year to year. And what that means for us as providers is it makes planning a little bit more difficult, right? So when you're able to kind of have somewhat of a baseline as far as expectations and how you plan to, be able to approach the upcoming fiscal year, if you will, from a budgeting perspective, staffing perspective, and the type of providers you're going to be able to work with, those things are key and paramount.
One piece of advice you would give to someone starting their own lab today?
Don't be afraid. Don't be afraid. It's not for the faint of heart. And there are definitely challenges in the landscape, but don't be afraid and ask for help.
And if you can go back in time, what would you say? What would you say to your younger self?
Sleep more.
Sleep more. Also.
Get some more sleep. So listen, the stress management is key, especially for any business owner or operator. The work's always going to be there, So work hard, but take it in stride.
Love it. Love it. Anything else you want to share with the audience, Alex?
No, I just want to say, I appreciate, Elias, what you're doing. This is something that I think is extremely useful and can help bring a spotlight to the industry and certain areas and, conversations that otherwise wouldn't be had. So I just want to take a moment to express my gratitude to you and for, this undertaking.
Alex, thank you so much for your time. We wanted to really be a platform where those independent labs can find inspiration, can find motivation, can find tips and tricks on how to develop this industry. You're contributing to care provider, you're contributing to the patient. You're definitely helping better work for everyone. So thank you for keeping up. We didn't speak about COVID, but you've been there also for in COVID, and you supported the industry. So I'm very happy and proud to be a part of this community and to have you also as a customer. That's really awesome.
Thank you.
So with that, I would like to thank you so much for sharing your insight and experience. And to our listeners, we hope this episode has given you valuable lesson and motivation for your own growth journey. If you enjoyed today's conversation, don't forget to subscribe and stay tuned for more inspiration stories from industry leaders. Thank you for tuning in. And until next time, stay innovative and keep growing. Thank you so much, everyone.
Thank you.
Thanks for listening to the Lab Entrepreneur podcast, brought to you by LabGen LIS, your laboratory information system powered by Medfar. If you're a startup or an established lab looking to optimize your operations, streamline your workflows, and enhance patient care, be sure to tune in for more episodes. Visit our website for more information today at labgenlis.com and unlock your lab's full potential.